Quickly, ladies and gentlemen, we have Dr. Randeep Guleria joining us, but let's bring you up to speed on the surge in COVID cases. Overall, Bharat, since the time of the pandemic, has seen 4,47,45,104 cases. Now, this is up by 6,049 fresh cases. The active cases are 28,303. That's up by 2,716. Total recoveries are 4,41,85,858. So the recoveries have also gone up by 3,320. Fatalities are 5.3 lakh approximate, up by 13. Now, where are the cases rising? Kerala, fresh cases 1,936. Total active cases 9,422, up by 1,193 cases. Maharashtra, fresh cases 803. Active cases 3,987, up by 113. Delhi, fresh cases 606. Active cases 2,060, up by 265. Karnataka 323. 1,516, up by 39 cases. Gujarat also seeing a spurt, down by 34 actually. Fresh cases 327, active cases 2,142. Tamil Nadu, fresh cases 273, cases, active cases 1,366, up by 150. Dr. Randeep Guleria, former director AI AIIMS, is also with us. He joins us exclusively here on the Right Stand. Namaste, Dr. Guleria. Your assessment of the rising COVID cases?
So I think because of multiple factors, we are seeing a rise in number of cases, and that's related to three main factors. One is, suppose that we are not following COVID appropriate behavior. We are not doing that, and therefore we've allowed the virus to spread from one person to the other, because masks, hand washing or maintaining physical distance is no longer being done. Secondly, the weather is such that it has allowed the virus to stay in the environment for a longer period of time. We're seeing unseasonal rains in many parts of India, and because of humidity, there is a higher chance of virus spreading. We see that not only with COVID but with influenza also. And thirdly, the virus is also mutated, and the new variant is infectious. It spreads more rapidly to infect people. Although luckily it's still not that virulent, it's still not causing a large number of admissions or deaths, and therefore we are seeing a surge in cases but not a surge in hospitalization or deaths.
Dr. Guleria, you mentioned a new mutant. Is this an extension or a mutant of the Omicron, or are you still waiting to see whether there are perhaps far more virulent mutations?
So this variant, the XBB.1 1.6, is basically a variant or a sublineage of the Omicron. It's a recombinant variant. It's still behaving like Omicron in the form of a mild disease, mainly an upper airway disease, fever, sore throat, cough, not like the Delta variant, which was going directly into your lungs and causing pneumonia and fall in oxygen saturation. So we are still seeing a variant which is similar to what we were seeing with Omicron and its sublineage for now more than a year. So I think the virus has more or less stabilized, and we've also got good immunity against the virus and therefore are better protected. But having said that, we always need to be vigilant and keep a very active surveillance, because we cannot predict how the virus will change and whether it may take a more virulent form.
Well, would you now then equate it like a normal flu? Is a 5-day isolation enough along with basic medication? Because it's still infectious.
Yes, so it is contagious, and for most people, it's just if you isolate yourself for 5 days, keep yourself well hydrated, take your medicines for fever, for cough, for cold, you should become all right and come out of it. But I would say that those who have comorbidities, those who are elderly, the high risk group, they need to be extra careful, both in terms of preventing themselves from getting the infection, so taking all the preventive measures, and if they get the infection, to get themselves tested, isolate themselves, contact their doctor, and monitor themselves closely, and if need be, they may need to be admitted in the hospital for treatment and for close monitoring, because they are at a high risk of more severe disease.
Dr. Guleria, how much will a booster dose help?
So currently what the data seem to suggest is that we have good immunity in the form of hybrid immunity. The immunity that vaccination has given us is still holding out, and many of us have had or had infection with the Omicron variant,
Ji.
which has been a mild infection but has given us good amount of immunity. So in general, the data seems to suggest that the population has good immunity and we may not really need a vaccine right now.
Okay.
Also, I think the other important question that we need data on is what is the right vaccine to give right now?
Correct.
The current vaccines that are available in India are basically from the Wuhan strain, the original COVID strain.
Ji.
But we've actually moved a long way from there. We've had the Alpha, the Beta, the Delta, and other variants, and now we have the Omicron variant and its sublineages. So it's possibly that if we have to have a vaccine, we will need a new generation vaccine which covers the new variants which are emerging and causing the infection.
But Dr. Guleria, there is a mixed opinion between taking the flu vaccine and the booster dose. Do you have an opinion on that?
So the flu vaccine is a vaccine against another virus, influenza virus, which is also causing flu-like symptoms, and we've seen a new emergence of the H3N2.
Ji.
Remember, before this we had the H1N1, which caused the swine flu pandemic also, the pandemic which we saw in 2009. The current vaccine, which is an annual influenza vaccine, is a quadrivalent vaccine. Quadri means it covers 4 strains. It covers the swine flu strain, it covers the H3N2 strain, and it covers 2 influenza B strains.
Ji.
So that vaccine is useful, and I would say all high-risk groups and all the elderly should definitely take it. Others can also take it, but it will prevent you against influenza infection. It will protect you against influenza infection. It will not protect you against COVID because that's a different virus.
Got it.
For that, you need to take your booster dose if you have not taken it as of now.
Ji. But coming to children, how risky is this current mutant or variant?
So again, the data suggests that children by and large are still getting a mild infection. We're not seeing a huge number of children being admitted with severe infection. But I would really advise parents that if your child has a flu-like syndrome, has fever, cough, keep the child at home. Don't send the child to school because what one is observing, children with fever, cough and cold are going to school and giving the infection to other children who then carry the infection to their house and then give it to their parents or their elders at home who may have comorbid conditions and may get a severe infection. Therefore, to prevent the transmission of disease,
Ji.
it's important that children stay at home for 5 days, keep them as well indoors as much as possible. They shouldn't be at home and start going to the shopping mall, for example. At the same time, take symptomatic treatment, and if they have high-grade fever, if there is coughing, or if the child is lethargic, not taking any feed, then it's important that they consult their doctor and for any admission or any medication.
The other question is wearing masks. We see advisories everywhere. Is it mandatory, precautionary, and more importantly, are the days of lockdown past us now?
So I think wearing masks would be a good thing that one should do. It should be more voluntary, and people should really realize the importance of wearing masks, not only to protect them against COVID, but influenza, tuberculosis, and also in places where air pollution is high, it also protects them against air pollution. So
Ji.
wearing a mask is a good thing. I don't think we're going to see lockdowns like we saw in the past because now the whole scenario is different. We have had vaccination, we have a good immunity. We need to be careful, we need to be conscious
Ji.
of isolating ourselves, but locking down a whole area probably currently will not really be of much benefit.
Dr. Guleria, final question and quickly, what kind of mask should one wear? What type of mask?
So I would say that for most people who are going out, even a surgical mask or a cloth mask is good.
Okay.
If you are in the high risk group or if you are going to a hospital,
Ji.
then you must wear an N95 mask.
Okay.
But by and large, a surgical mask or a cloth mask is also good enough to protect you.
Thank you. Thank you for your time, Dr. Randeep Guleria, and for also answering some very, very key important questions. Thank you very much. With that, we call it